You treated the very first COVID-19 case here in the United States. That was a year ago today. That was just one case. And now we're at 24 million cases in the US, 400,000 deaths. Did you think that it would get this bad?
No, I don't think anyone could predict that it would have gotten this bad in the US. We've seen other advanced nations control the virus much better than we have, places like South Korea, Taiwan, Japan, and one would have hoped that we would have had a response similar to those countries.
What do you think the response should have been earlier on to stop and prevent what we're seeing now?
Well, I think that what we really needed to have was a unified national plan for dealing with the virus. The recommendations from public health from the CDC were pretty clear about, wearing masks, socially distancing, etc. And unfortunately, at the federal level, we got mixed messages. And that resulted in many of our people in the US not obeying public health recommendations. And that, I think, made the situation much, much worse.
And when you saw the coronavirus a year ago, it was so new. I think scientists, doctors were just getting a handle on what exactly it is and the effects. What was going through your mind when you were treating that very first patient?
We had been monitoring this pretty closely before our patient arrived, and we were seeing the reports in China coming out of Wuhan where there were a lot of people being infected, there were deaths, and really the response of the Chinese worried us greatly because we saw them lock down full cities and regions to try to get a hold of this infection. And so what we saw from them was they were very startled by this pandemic in their own country, and that made us very worried that it was going to be similar here. So we did a lot of work to be ready for having patients like this. And so when our patient arrived, we felt pretty comfortable that we could manage him. What we didn't know was how bad it would get over the next few months.
Where did you think we would be now a year later?
My hope was that we would have been able to control this infection. We would have had the capacity to do the testing that was necessary to get our people tested, that our people would have obeyed, public health measures, and that we could have gotten things under control while we waited for the vaccine. Unfortunately, that didn't happen.
How do you think that we'll get people to be more comfortable with the vaccine, specifically people in communities of color?
Yeah, you're absolutely right. I think that, this pandemic has disproportionately affected, brown and black people. There have been many more hospitalizations and many more deaths amongst our communities. And even within our communities, there's a lot of hesitation. And I think what it requires is really consistent messaging coming from all levels of our society, from our local public health people, our health systems, our governors, are the people that are, the ones that are influencing our population, as well as the federal government, all have to be on the same page in giving out the right messages, especially to minority communities that have been so hard hit. And I think that unified messaging will hopefully really help get people to get themselves vaccinated.